So they're not investing much time. If you look at the history of the patient, as they come in the door and talk to us about what they've done or what they haven't done, what they've tried, what they've not tried, this is quick. This is very quick.
Well, you're talking 6 to 8 weeks. We have maternity leave for 6 to 8 weeks, even, and that's so minimal.
Not 6 to 8 weeks. No.
Treatments.
Treatments.
6 to 8 treatments.
Yes.
6 to 8 treatments. And
that can be accomplished in 3 weeks.
Well, if they come in twice a week, yeah.
Yes.
Exactly. But I'm just saying, you know, putting this in perspective, a recovery time with someone which mandatory maternity leave is 6 to 8 weeks. You know, you look at that time frame, and if someone can get actually feeling better in a shorter amount of time, I don't want to say pain-free, but actually it is pain-free, and to get rid of the symptoms, then we also have, you know, a win-win situation right there.
And it does happen. It's relatively fast. You're absolutely right.
Right.
In the overall scheme of things, my goodness, if you were to have a surgery and then have to go into recovery.
Well, had they performed a surgery on your knee,
I
you
was
would
so
have been minimum of 8 weeks.
And I saw that as if that had happened, I was afraid that was kind of the beginning of the end of my mobility as I enjoy it, because I know a lot of people. I know dancers who have had things done, and it, you know.
Yeah.
So this sometimes is a wonderful substitute for other therapies.
Okay.
Because it's very quick, and if they fall into the category that we specialize in, this myofascial pain.
What's myofascial mean?
That is a muscle injury that has a fascia component. Fascia coats all the muscle fibers of the body.
So it's a muscle injury.
It's a muscle injury
that has affected the coating of the muscle.
Yes, the fascia.
You see, you could have said that instead of myofascial, which made me think, I
But
don't know what he's talking about.
I have to use the right terms.
Yeah, exactly. We did go into that in his last interview. So
I did see that, yes. I could have taken my notes from that one.
Well, that's the medical terminology for the type of injury. And frankly, muscle injury leads all in the category of pain. There's a muscle component to virtually every injury that's ever come through our door. And often, it's the only part that needs to be fixed. The chiropractor has done his work, but if the pain persists after these other therapies, these are the people that should pick up the phone and call us. You know, I had the opportunity to steer Nancy in.
Yes.
She wasn't going to come.
Yeah.
She had,
I was on my way to the other doctor.
This is divine providence. You need to pay attention.
You did, and I'm so glad I listened.
And try this, because you're going to be amazed. Well, certain skepticism, and I don't blame that.
No.
Well, but the wonderful thing, Tina, and I know that, of course, you've talked with Ed a great deal, the wonderful thing in the consultation that you did beforehand is that any skepticism I had was gone.
Okay.
Because naturally, I was just concerned that, are you going to do something that could hurt me? I mean, could this make it worse?
Right.
What's the downside here? And literally, you explained that the downside is that maybe it won't work.
Right.
There is no other downside. So to me, that's kind of a no-brainer. I hurt. It's most likely going to work. There's absolutely no downside. Sign me up.
Right.
Perfect scenario.
Yeah. And that's so fantastic, because I hate to think of what the alternative would have been, especially with your quality of life and how busy you are. And to have a knee injury, it's devastating for the rest of your life.
Well, it is for people, isn't it? And they have surgeries. My husband had 2 knees replaced. He ended up, because of a very arthritic family, walking bone on bone. Now, it's likely that he still needed to have those knees replaced because he was bone on bone. But the recovery could have been, as I look back on it, it could have been so much, because he had both knees done at the same time. And bless his heart, he paid for it.
It's a struggle to come back, and the older we are, the harder it is.
Yeah.
So if you're 30 years old and have that happen, compared to 60, big difference. Recovery time is horrible.
One of the things that Ed did recently, and this seems so dumb, but when I went down the stairs, so that I didn't fall, I jammed into the wall, so much so that I went like this, and I peeled all these fingernails back. I jammed in so hard. Well, all of a sudden, this finger has this knuckle swollen, and it hurts in here. And Ed said, oh, sure, you did something to your muscle there, too. So he grabs the little magic wand, and it doesn't make a noise. I'm just making a noise. Did this. It doesn't do that. It doesn't go, that's Nancy sound effects. And you did this, and you did this. And I went home, the next day, and this was fine.
So it took care of that in one treatment.
Yeah, yeah. So now I'm just going to turn my entire body over to you. And we'll start.
Leave it on my doorstep. We'll take care of it.
Exactly. We'll start from the ankles up and go.
Yeah. So how is your knee now?
Perfect.
Obviously, yeah.
Absolutely perfect. After, as you said, actually, I thought it was the 4th treatment, but then I remember we did do kind of a little tweaky.
I think you called. You wanted just one last look at it, and
but the fact that I walked in and did this, and I just threw my leg off the table and walked all around the room. And the next morning, there was no water left on my knee. That was going to be quite an ordeal of drawing it off with needles and everything. To me, that was astonishing, but now I have no residual at all. And I'm so grateful for that, because it really could have been a pretty bad deal.
those types of injuries can linger on and on and on.
Yeah. And at my age, 37. Don't laugh so hard.
We're in the same boat, my dear.
Are we?
I think so.
I'm rowing so fast.
Yes.
Some days it feels
We're
like I can't paddle fast enough, Tina.
Okay, yes, I know. The saying goes to do something in 24 hours that takes someone else 36. Trying to go so fast.
Yes,
Exactly. So I kind of want to talk a little bit. You said you're going to turn your body over to Ed.
I sort of have. you know.
Yeah, we wanted to kind of talk about also alternative type of relief that you're getting, cosmetic, as it's saying goes.
Ed has. Here's how the rest of this happened. Okay. I have had, since I'm not a heavy person, 5'2", and have until recently weighed barely over 100 pounds my whole life. But my mother had a lot of spider veins in her legs and a lot of cellulite. Okay. And we inherit everything from the color of our eyes to, and I inherited that. So I had not put on a pair of shorts or worn a bathing suit in public since before I turned 30 years old. Wow. Because my legs, seriously, you can
cellulite knows no age.
But it's not weight related, which is really interesting as well. So as Ed is doing this to my leg, my vanity, which has been in place with these awful legs for all of my life.
I hope you weren't too embarrassed.
I was. Well, I was, because finally I said, I'm so sorry, you have to look at all that cellulite. It's so terrible. At which point Ed said something nice, and then we talked a little bit more about it, and then you did say,
I have something for that.
Yeah, but before that you said, well, it doesn't seem that nature can always be fair, but this is really some of the worst I've ever seen.
Yes.
And I've never. My legs look like Austrian drapes. It was really, it's awful. So anyway, Ed said, we have something for this. Now, I have talked to plastic surgeons. I have gone to massages. I have had the things where they do the wraps and the, you know what I'm talking about, don't you? And it gets rid of a little bit of the water for a while, and then 20 minutes later you look like a,
or the next day,
large curd cottage cheese container again. Yeah. So when Ed said, well, we can do something about that, my immediate...
Now, did you believe me when I said
that? No,
of
course not.
Because, you've been there before, haven't you?
Well, and because there isn't, to my knowledge, anybody who deals in the beauty industry that I haven't met with about this for years and years and years, because it's been such a problem to me. And you explained to me that you could do something, but why is it that this would respond to what you do when everybody says nothing will make it work?
Well, every once in a while, something legitimate comes into the market.
Yeah.
And that's the best explanation I can give you, Nancy. The science behind what we do is provable and reproducible.
But what does it do to... Before I ask you what it does, I will tell you, Tina, that...
well, tell her if it worked or not.
After the first treatment, I went home and I looked in the mirror and I said, no kidding. Now, I still have cellulite. I have 1/5 the amount of cellulite I had when I started, and I've had 6 treatments.
Which is a short amount, or low amount, actually. I mean, I've had ladies come in who said, I want rid of all of this. They had a horrible process like you were.
Oh,
and,
really
15 to 20 treatments, they have none. And they say the nicest things. Oh, I don't have to wear pantyhose anymore. I can expose my upper leg. Wow. I'm not embarrassed. There's nothing to be embarrassed about.
Well, even to the point where when I would be out and wear a skirt, that was below your knees, but when you cross your legs, how it comes up, something would show you, and I would just die. So I would say that my cellulite is 80% gone. Wow. and all I had to do was go to 7 treatments so far, and I lay down on the table, and and again, but this time it's up and down and up and down, and one day we'll do the top part, and then I flip over like a pancake, and another day we do the bottom part, and it's a miracle. I'm actually going to this summer
Wear a bathing suit. Imagine if this would have been available 30 years ago.
It'll be the first time in decades. But no, good for you.
Well,
so that
I wish more women would hear about this now.
Yeah, certainly you hear about women with cellulite all the time.
Oh, yes, but they claim that there's no remedy for it.
They say there's nothing you can do. It doesn't matter. Well, Ed did it, and that's what's so amazing to me, because supposedly there's nothing. But that brings me to the question, if you don't mind my asking, because I haven't up to this point.
Go ahead.
With the magic wand, what does it do to this cellulite that everybody says could not be done?
Fat is stored. Correct?
Yeah, that's the cellulite. There's fat stored in the cells.
There's a membrane.
Yes.
And this destroys it. The topical that's applied penetrates several layers of skin, getting actually to the cellulite. And it begins to degrade it. So the membrane that
this stuff is held in, which causes it to pop up.
Yes, you get that puckering. It stacks. Right. And it's very unsightly, as you know. So this begins to degrade that. So the fat now metabolizes. We open the blood supply so it can get to the liver and metabolize.
What does that mean to my body? Because I have not felt any ill side effects or anything.
You won't. That's a natural process. All fat is metabolized through the liver. If you get on your treadmill at home or at the club, and you run and you exercise, you're burning fat. That's the natural process.
That's what you did?
That's what they say, that's the only way to get rid of it.
No, cellulite won't burn that way. Cellulite will not burn that way. I have seen young women in their 20s, horrible cellulite deposits on their legs. Running, it doesn't go away. It's a different type of fat.
So your process breaks down the membrane that is holding all of this
kind of protecting the
waste
fat.
Product.
Yes.
Because it is waste product at
and
that
you can
point,
imagine the
isn't it?
toxins in that fat, because the body will store toxins. Usually, it's been well understood in the fat.
And you know what we're going to have to do is have your website put up, have them give you a call, come in and visit, because we've run out of time.
Oh, I'm sorry, I talked too much.
Not
you
at
have
all.
such a great show, and all I did was talk.
But that's why I invited you on. It's fabulous.
I just think it's wonderful that you do this for people. I think it's good for you.
Well, thank you.
Congratulations.
And I feel honored that I had Nancy
Oh,
Nelson on my
please.
show.
My great pleasure.
Yeah, that's great. Well,
next time I'll wear something short and you'll be able to look at my legs.
You'll be able to. Want to see you at the beach this summer. Thank you,
Mr.
Tina, for
Leffler.
having us on.
Thanks, Ed.
Enjoyed
Thanks
it
so
very
much.
much.
Good
to see you again, Nancy.
Okay. All right, please be sure to tune in again for other shows of Knowledge for Wellness to enhance your overall understanding. And please visit my website at www.knowledgeforwellness.com and let us know where you saw the show. And I hope we have provided you with more knowledge to benefit you and your loved ones. So until next time, take care and be well. And goodbye. Thanks again.
Thank you.
That was great.
You're such a pretty...
Over time you've healed so much in me, and I am living proof that although my darkest hour had come, your light could still shine through. And at times it's just enough to cast the shadow on the wall. Though I am grateful that you shine your light on me